When it comes to the role of professionals, there are four views: functionist, Marxist, feminist and interactionist. Okay, firstly, the functionists believe that doctors are altruistic and that their job is to keep society functioning, but that they do it for the good of the people and not for the good of themselves. Parsons 1951 said that doctors have created a sick roll that keeps society in place even when people get ill. And the sick roll is the idea that there's like a normal way to behave when you're ill, and this includes going to the doctor, getting a prescription, picking up the medicine, having a few days off, then going back to work. And by having created this sick roll, even when people are off, everything still works because we've got a way of making it work. And it prevents it from becoming a threat to society. Another example of doctors being altruistic is the fact that they have to take the Hippocratic Oath before that they get qualified, and it's the idea that they're saying what I do, I'm going to do for other people and not for my material benefit. So it basically means they're not going to do it for the money, they're going to do it because making people better is the right thing to do, and that is what functionists believe the role of professionals is in the health industry. Marxists believe that doctors also keep society functioning, but that they do it to maintain a healthy workforce, so they're kind of looking at the economic side of things. Navarro in 1985 said that doctors make money for the medical industry, for things like pharmaceutical companies and things, and that's what the role of professionals is. It's to make money for our society, selling medication like GlaxoSmithKline make the money, and that's what they believe is the kind of aim. Woff believes that this is also backed up by the fact that doctors run private practices alongside their public jobs, which shows that they're not out to save more lives, they're actually out to make more money, because instead of putting more of their time into like the NHS and free healthcare, they're running private businesses, which obviously they get paid commission for, and that's Marxists in the role of professionals. Feminists believe that the role of professionals is to maintain patriarchy in society. Abbott and Wallace in 1990 says that medicine controls women. For example, you go to the doctor with the signs of menopause and they'll give you medicine for it, and it's like saying there's something wrong with you because you've got menopause, when actually it's a natural process. Jordan over 1989 believes that medical conditions are linked with women. For example, more women are diagnosed with mental illness, so they think that when you go to the doctor with something wrong with you, the diagnosis is actually based on your gender and not your actual symptoms. And Turner 1987 states that the biomedical model controls women's sexuality and reproductivity, like when you're pregnant, they'll decide what you should do instead of you deciding yourself what you should do. Lastly is the view of the interactionists, and they believe that patients and doctors take on a role dependent on social profile. An example of this is that people of the working class have been proved to have shorter and fewer consultation times with doctors, and it suggests that you take on the role of someone like in a lower social class, so you don't get the same care and treatment as someone of a higher social class. Bryan and Long 1976 said that this links into how through society we learn to control the impressions people have of us. Foucault 1973 says the use of discourse, which is like medical terminology such as disease and symptoms, shows that medics actually have a lot of control over patients, because they use things that scare us into listening to what they have to say, because they use language that we might not necessarily understand, so that then we're more likely to be freaked out and just go with what they're saying to us.